Hi, this is Dr. Naidu. I'm a board-certified plastic surgeon in New York City, and today I'm going to talk to you about what to expect when you go in for your surgery and right after you wake up. So when you come into surgery, you'll come to either the hospital or an outpatient surgical center. You'll be met there by the anesthesiologist, and you would see me or your surgeon. And at that time, we make a bunch of markings on the chest, and your anesthesiologist reviews your medical history with you and puts in an intravenous line. Then we go down the hall to the operating room, and the anesthesiologist puts you under general anesthesia, which means that you're completely asleep with a breathing tube down your throat. And this ensures that you'll be completely safe, completely protected, and completely comfortable. You'll be completely out for the surgery. You will not wake up during surgery. You won't remember anything about the surgery. And I do this for two reasons. One is that I want you to be as comfortable and safe as possible. The second reason is that I want your muscles on your chest, your pectoralis muscles, to be completely relaxed. And the reason why is because I'm going to be putting the implant underneath the muscles. And I do that in 99% of my cases. So that muscle needs to be relaxed. The medication that's used to relax that can really only be given when a patient is under general anesthesia. It's just truly not safe to do it any other way. So the surgery is then begun. It takes me about 45 minutes to an hour to do a breast augmentation, a straightforward case. And by that I mean from the minute I cut the skin till I put the last stitch in. So about 45 minutes to an hour. After that, the anesthesiologist wakes you up and we transport you to the recovery area. And there you're watched by the anesthesiologist and the recovery room nurses for about an hour to an hour and a half. Everyone's a little bit different depending on how quickly they recover. Some people need a little bit more time. Some people recover from anesthesia very quickly. After you're awake enough, the nurses will give you something to eat and drink, and they'll watch you for a little bit longer, and then they'll let you go home with a responsible adult. It's very important that you have someone to be with you when you leave the hospital or surgical center. And actually in New York State, we cannot legally let you leave without an adult escort. This is really for your safety. After you go home, I ask my patients to go and take a nap for about 2 hours, 2 to 3 hours, and then get up and start doing some light activity. I also recommend that you get into the shower, get a nice warm shower going, have someone help you if you're feeling like weak or dizzy, but get into the shower, wipe off the markings I made on your chest, and just start moving your arms around. Because the tendency after breast augmentation is to put our arms in almost in a protective position because our muscles are tight after that implant has been placed underneath them. So I recommend that you get in the shower, let everything loosen up, take some pain medication, have a little something to eat, and then I ask patients to start doing some very controlled arm exercises. And these are gentle exercises, which I'll show in a different video, but we're really letting the muscles open up and stretch out. They're very gentle, they're very safe. They're not going to disrupt anything in any way. They will not open up your incisions. But what it's really meant to do is just relax the muscles and get them stretched out so that you can get back to your regular activity as quickly as possible. I started doing gentle exercises of the arms for my patients about 8 to 10 years ago, and I found a big difference in how quickly people recovered. Initially, patients would really need to take a week off from work to really recover. Now most of my patients are back to work within 3 to 4 days, and it's just made a huge difference. Most recently, I've started working with a group of yoga instructors doing restorative yoga on my breast augmentation patients, and that's been very exciting, and that's really gotten people back even faster. So like I said, I'll do that. I'll present that in a different video. So after you do your arm exercises, which I recommend patients do twice a day for 2 weeks after surgery, after you do your exercises, just go about your regular activities. Do light activities around the house, even the night after surgery. I wouldn't go out dancing or anything like that, but if you want to go out for a light meal, you certainly could if you feel up to it. You shouldn't be completely in bed and debilitated by your surgery in any way. After that, you will come back to see me about 3 to 5 days after surgery. At that time, I'll just be taking a look at your incisions. And all you're going to have on your incisions are these. These are little steri strips. They're literally pieces of tape that go right on your incisions. You will not be wearing any special bras after you wake up. You're not going to have any pain pumps. You're not going to have an ACE wrap wrapped around your chest. And that's because we really haven't found that actually does anything significantly. I know that some of my colleagues do still like to use the ACE wrap, and some of my colleagues also like to have patients wear a bra day and night for 6 weeks after surgery. I don't do that. I just have patients wear these little guys on their incisions. And once those fall off, you're done. You can start putting on scar gel or whatever you want. Again, it's because there just isn't any data to show that any of that other stuff really makes a difference, and I haven't seen any difference in my patients. The other thing that I like not to do, the other reason why I don't use any compressive dressings is because I want you to move. I want you to get back to activity. And the tendency when patients are wrapped really tight with ACE wraps or really constrictive bras is they're going to hold their chest like that. They're going to hold themselves in a protective position. They just won't move. So that's it. That's really my general post-operative regimen. I see patients 3 to 5 days after surgery to check on them. Then I like to see them again at 6 weeks, 3 months, 6 months, and then a year out from surgery. After that, I see patients once a year for just a routine visit. If there are any issues in the interim, we certainly get patients in, but that once a year visit is just a good way of checking up and making sure that everything's okay. So that's it. If you have any questions, please go to my website at www.naiduplasticsurgery.com. And thanks for watching.